Good morning. Thank you again. My name is Wendy Porch, and I'm the Executive Director of the Centre for Independent Living in Toronto, also known as CILT. We are a disability-led organization by people with disabilities for people with disabilities, and our aim is to develop and implement dignified social services that empower individuals rather than create dependencies. I'm also a member of the City of Toronto's Accessibility Advisory Committee. I'm a person with a disability, a mom, and a proud resident of Toronto. According to StatsCan, as you heard earlier today, 22% of Canadians have disabilities. In Toronto, 22% of the Toronto population is approximately 1,300,000 people. Worldwide, 46% of people age 60 and over have a disability, and globally, 1 in 10 children have a disability. So we are not a small group of people. People with disabilities are also not a homogenized group. Toronto residents with disabilities have a range of identity intersections and are found in all cultural communities, all LGBTQ and two-spirit communities, and all religious groups. Despite our large numbers and our diversity, one thing we disabled people all have in common is that we are largely invisible in COVID relief and recovery efforts. The facts are, people with disabilities are at greater risk of contracting COVID-19 because social distancing from support workers isn't possible, because public health information isn't accessible, and because PPE isn't readily available. People with disabilities are at greater risk of severe health outcomes and dying from COVID-19 because for some, their conditions predispose them, and for others, healthcare facilities are still not accessible. Also, many people with disabilities live in institutions, and many of those folks who have died in long-term care and retirement homes are people with disabilities. People with disabilities, unlike you, can be refused access to life-saving procedures in the event of a COVID surge under Ontario's triage protocols. Even before the pandemic, people with disabilities were already amongst the most socially economically disadvantaged in Canada, with unemployment rates of about 50% and ODSP providing only around $1,100 per month. And things are worse now. The City of Toronto's Accessibility Advisory Committee met twice with Mr. Raffi and the TOR team to provide input into the TOR process. I do not see those extensive conversations reflected in the Impacts and Opportunities report. Only one recommendation, number 42, related to cultural disability community, says anything specific about my community. This is a shame because if the conversations we had were reflected here, you would have learned that we need much more than cultural programming. We need, as you heard earlier, the city to adopt a disability lens and incorporate it into all of the policies and procedures. Where are people with disabilities in any of these plans? Why aren't we prioritized too? We need people with disabilities to be named as a vulnerable group and to be acknowledged as disproportionately impacted by the pandemic, and we need targeted plans for addressing these impacts. We need the city to consult with disabled people about new initiatives related to COVID. To my knowledge, Cafe TO, Curb TO, Active TO had no consultations with disability community stakeholders, including the city's own Accessibility Advisory Committee. Many of these initiatives were inaccessible as per the numerous news stories we heard in the summer. We need the city to work with Public Health and Ontario Health to address the lack of accessible COVID testing. Many members of our community cannot get out to be tested, and there is no mobile testing for people with disabilities who reside in the community. We need better access to PPE. Accessing PPE has been extremely difficult, and the community has had little to no financial support in sourcing it from any level of government. We need the city to do better with accessible communications across all channels. We need American Sign Language interpretation to be available wherever there are public meetings. We need City of Toronto websites to be accessible, and we need the city's consultations tools to be accessible as well. We need more accessible and deeply affordable housing. We also need disaggregated disability data collection to begin now. We know that there are plans to do this in the future, but the pandemic is now, and we need the city and public health to collect this data because currently we can't even measure the impact on people with disabilities because no one has this data. And most of all, above all things, we need to be visible in the COVID-19 efforts. This is the only community who can legally be refused life-saving treatments, and yet here we are again trying to find ourselves in the COVID response and recovery plans. We urge the City of Toronto to develop a disability and COVID-19 advisory group, like the federal government has done, that would work alongside all of these other initiatives to ensure that we are not left behind. Thank you.